The major complications after heart surgery include bleeding. 0.5 to 1% of the time, we have to take you back to the operating room because too much blood is coming out the chest tubes. We take you back, open you back up, take care of the problem, close you back up, and start over again. Usually that happens the first 6 to 12 hours after surgery. Infection. Anytime we do anything to the body, that can happen. We'll give you antibiotics before, during, and after surgery to reduce that chance, but infections can still happen. Infections of the sternal incisions can be very bad. If they go deep and get into the bone, we may even have to do another operation to wash things out, clean things up, and sometimes even a third operation after that to reconstruct things. Sternal wound infections occur between 1 and 2% of the time. However, at our hospital, it's 0.2% of the time. Other types of infections include pneumonias, bladder infections, or IV site infection. Anytime we put a tube anywhere in the body, we can introduce infections or they can get infected afterwards. Usually just removing the tube and changing the antibiotics takes care of it. It's also very important that while you're in the hospital, any visitors that come to see you and all healthcare providers use a special soap on their hands that are in the dispensers on the wall. They should put them on their hands every time they come into the room and leave the room, whether they touch you or not. And it's okay to ask your healthcare providers if they've done that or not. Risk of a heart attack after surgery. It's very uncommon, but anytime we're operating on the coronary arteries, that can happen. We see that less than 0.5% of the time. The risk of heart failure. This could happen when the heart function is not strong enough to do the work that it needs to do. Typically, we'll see this in patients who have pre-existing heart failure problems. The need for a permanent pacemaker. If we're doing valve surgery, we see that about 1% of the time patients will need a permanent pacemaker after surgery. Atrial fibrillation is very common after heart surgery. We see it 30 to 40% of the time. It usually happens around day 3 or day 4 after surgery. Atrial fibrillation is when the atria start to quiver and beat really fast. It doesn't convert to ventricular fibrillation. That's the bad one where we have to shock your heart, but it just makes your heart rate go very fast. You may not even notice that you're in it, but the nurses will come running into the room to check your blood pressure, ask if you're doing okay, because they'll see that your heart rate went to 140 to 160 out on the monitors. We just treat that with medicines to get it under control. You're usually on those medicines for about 6 weeks after surgery. It's very common to feel your own heartbeat after surgery. Again, this usually happens around day 3 or 4 after surgery. You'll notice your heart start to beat, and you sense that it's beating very, very fast, and you feel like it's going to beat right out of your chest. It can be so strong that it even shakes you in your bed or chair. Just changing positions usually takes care of that, and it goes away within a week or 2. It can be very unnerving when it happens if you don't know that it's normal. You can have a stroke with heart surgery. Typically, it's less than about 0.5% unless you have other risk factors. A stroke is where half of the body is paralyzed after surgery, or the thinking part of the brain doesn't work, or even the talking part of the brain doesn't work. You may have to come back to the hospital after you've already been discharged. About 5 to 8% of patients need to be readmitted to the hospital for problems that occur after heart surgery. And finally, dying from heart surgery. Typically, risk of dying can be as low as 0.5%. Depending on other risk factors, it can be higher, however. Typically, for aortic valve replacement surgery, the average mortality rate is 2%. Elective mitral valve surgery is about 1%, and bypass surgery is typically less than 1%. And again, if you have other risk factors, that can increase. Now, I've been doing heart surgery for 19 years. 16 of it is here at St. Joe's Hospital. My mortality rate for bypass surgery is 0.5%, and I've done over 4,000 heart operations in my career.